How is Parkinson's disease clinically diagnosed? How is Parkinson's disease diagnosed? This is a question many people have, especially those who may be experiencing symptoms. Parkinson's disease is primarily diagnosed through clinical evaluation. There is currently no single laboratory or imaging test that can confirm the disease. Instead, healthcare professionals, often neurologists or movement disorder specialists, relying on a detailed medical history and a thorough assessment of symptoms. The key clinical feature that must be present for a Parkinson's diagnosis is bradykinesia, which refers to slowness of movement. Along with bradykinesia, at least one of the following motor symptoms must also be present: resting tremor, which is shaking in a limb while at rest; rigidity, which is stiffness in the arms, legs, or trunk; or postural instability, which involves balance problems and falls. Together, these symptoms define Parkinsonism, the clinical syndrome that underlies the diagnosis of Parkinson's disease. To enhance the accuracy of diagnosis, the International Parkinson and Movement Disorder Society has established formal clinical diagnostic criteria. These criteria include absolute exclusion criteria, which are signs or symptoms that, if present, rule out Parkinson's disease. For example, certain eye movement abnormalities or a lack of response to Parkinson's medications can indicate that the diagnosis should be reconsidered. There are also red flags that suggest alternative diagnoses and supportive criteria that reinforce the diagnosis of Parkinson's disease, such as a clear response to dopaminergic medications. Diagnosis can be categorized as clinically probable or clinically established Parkinson's disease based on these criteria. While brain imaging, such as magnetic resonance imaging or dopamine transporter scans, can help rule out other neurological disorders, they cannot definitively diagnose Parkinson's disease. Blood tests are typically used to exclude other potential causes of symptoms. In some cases, a trial of Parkinson's medications, like levodopa, may be administered to see if symptoms improve. A positive response to this treatment can further support the diagnosis. Since Parkinson's disease symptoms can overlap with other conditions, diagnosing it can be challenging, particularly in the early stages. Follow-up evaluations by specialists over time are crucial for confirming the diagnosis and making any necessary adjustments. In summary, diagnosing Parkinson's disease is a clinical process that involves identifying characteristic motor symptoms, ruling out other causes, and observing the response to treatment. This approach is guided by internationally accepted diagnostic criteria and reflects the current scientific understanding of the disease. If you or someone you know is experiencing symptoms, it is essential to consult a healthcare professional for personalized medical advice.